am Katie Ross with Jacksonville Community Council Incorporated in Jacksonville, Florida, and I'm here at the 2011 NAPC conference, and I'm joined here by a speaker from our panel talking about healthcare reform on a community level. So if you could just tell us where you're from and what's your name?
Sure. My name is Allen Lomax. I'm actually here. I'm a resident of Alexandria, Virginia, and actually in multiple roles. I actually serve on the Community Indicators Consortium as their co-director for an integration project and also for the grant with the Robert Woods Johnson Foundation. And actually here in Alexandria, I'm vice chair of the Partnership for Health for Alexandria. So.
And could you give us an overview of what you talked about during the panel today?
Sure. What I chatted about today was really this project where for communities where they're supposed to be developing their community needs assessment and community health improvement plans. And really when you develop those, about the importance of having community indicators as part of that process, as well as performance measures, both in the health improvement plan, but also with the local health department, and how those performance measures should roll up or have some sort of connection to those broad community indicators that are in the community health, in the community needs assessment.
How important of a role does community engagement play in planning for healthcare reform at a local level?
Huge. You know, it's one of these things, particularly if you think about community indicators or anything else. Nobody likes to be told what they think they should be focused on. What they want to do is be a partner and be asked and have some sort of a stake in the game. Because if you just direct people and tell them really what they should really think about and not really get their own opinions and get a broad community consensus, otherwise, so you're not getting community values if you don't do that. And two, you're not going to get community members who are actually going to support the initiative as it moves forward.
What do you think was the major takeaway from today's panel?
Change is hard. There's a lot of unknowns with the healthcare reform. There's a lot of things going to be rolling out, and there's a lot of things that may be revised as we move forward. But I think the important thing is we have to think about what we're doing today, what currently exists, what we think will be in the future, and we need to keep moving forward and not get paralyzed by concerns that things may change in the future. But again, I think one of the most important things is really broadly engaging the widest diverse members of the community as possible in having these conversations.